ambience Gurugram, which is actually done by nearly 350 cardiologists attend the meeting. It is basically to train and exchange knowledge between among cardiologists from India, across India, also from other parts of the world. We will have 14 live cases showing during this time, which will be shown in the auditorium from different parts of the world. The live cases are coming from 2 centers from Japan, 1 from Italy, 1 from Egypt, 1 from Canada, then other cases are coming from BK Hospital Faridabad as well as Sector 10 Civil Hospital Gurugram. This is actually regarding 100% blockage in heart vessels which supplies the muscles. Earlier, when there is a 100% block happens in any blood vessels, they go for bypass surgery. Now this is actually turning out. People with excellent skills, training and good materials available, we can actually send this patient for angioplasty. So this is actually to train people, not only in India, all over the world. Many people are even coming from Nepal, Maldives, Sri Lanka, like that, all the countries nearby. Many people would have come more only because of the COVID and the issues of fear, people are not coming. Otherwise, nearly 350 cardiologists and nearly 400 attendees will be there in the meeting. Not only from Delhi, all over India it is coming, also from other countries. And basically to train, and this is actually it's happening. The people coming from the major operators are Dr. Kenji Kawajari from Japan, Dr. Nagamatsu from Japan, Dr. Kenya Nasu and Hamasaki from Japan. These are all big operators in Japan. Then Gerald Werner from Germany, then Galassi from Italy, Dr. Sanju Kalra from Canada, and these are and Khalid Tamam from Egypt are the operators. From here, it is done by IJCTO. I am the course director and the organizing secretary. My name is Dr. Prathap Kumar, and also other 3 course directors are there. Dr. Surya Prakash Rao from Hyderabad, Dr. V.V. Ganesh Kumar from Mumbai, and Dr. P.K. Goyal from Lucknow. These are the 4 course directors doing this meeting. I think Dr. Gunjan also can explain.
जैसा कि सर ने बताया, फ्राइडे सैटरडे संडे IGCTO कॉन्फ्रेंस हो रही है होटल लीला गुरुग्राम में. एक इंडो जापानीज CTO कॉन्फ्रेंस है. CTO का मतलब होता है जिसमें 100% नस जो दिल की है उसको बंद होती है, उसको हम एंजियोप्लास्टी के द्वारा खोलना. तो इट इज़ इंडो जापानीज. इसमें बेसिकली जो नॉलेज टेक्नोलॉजी वो इंडो जापानीज में ट्रांसफ़र होती है, वो एक दूसरे को सिखाते हैं. उसके अलावा वो ये एक लाइव कॉन्फ्रेंस होती है जिसमें हम इस बार हम टोटल 14 केसेस कर रहे हैं जो कि इंडिया के अलावा बाकी दुनिया में भी लाइव टेलीकास्ट होंगे.
जापान,
तो जापान में है,
इटली,
जर्मनी, ये सब जगह टेलीकास्ट होंगे. इसमें जापानीज़ के अलावा हमारे पास जो इंटरनेशनल फैकल्टी आ रही है उसमें डॉक्टर जेराल्ड वर्नर हैं, डॉक्टर ग्लासी हैं, डॉक्टर
Khalid Tamam
फ्रॉम इजिप्ट. ऑल दीज आर पीपल आर कमिंग एंड डूइंग द लाइव केसेस इन इंडिया. ये सब लाइव केसेस करेंगे इंडिया में, इटली में एंड कीनिया में. सो एक ये अपने में एक अलग ही कॉन्फ्रेंस है. जो पहले नसें जो 100% होती थी, बेसिकली एक टाइम होता था जब हम कहते थे 100% नस बंद है, इसको बाईपास के लिए रेफ़र कर दिया जाए, या उसको खोलो ना या उसको दवाइयों पे रखो. अब समय बदल गया, टेक्नोलॉजी नई आ गई है. तो ये वो एक कॉन्फ्रेंस है जो हमारे को आगे जो यंग कार्डियोलॉजिस्ट है उनको बताती है, सिखाती है कि इसको कैसे खोला जा सकता है, क्या टेक्नोलॉजी आगे एडवांसमेंट आ गई है जो हम कर सकते हैं. तो जैसा सर ने बताया, ये सर उस कॉन्फ्रेंस के खुद एक कोर्स डायरेक्टर हैं. तो ये 8th ईयर में अपना एंटर कर रही है. ये दिल्ली में फर्स्ट टाइम हो रही है, करेक्ट सर?
या दिल्ली में फर्स्ट टाइम है. यूजुअली इट इज हैपनिंग इन मुंबई, Hyderabad and Kerala. This is actually this 8th conference. Actually, it is supposed to be the 10th conference. Last year and the before 2 years, 20th and 21st, it is not happened because of the corona.
तो इसमें तकरीबन 550 कार्डियोलॉजिस्ट नेशनल एंड इंटरनेशनल शामिल होंगे. सबसे इसमें ख़ास बात ये है कि इसमें जो केसेस लाइव केसेस है, जो इंडिया से लाइव केसेस हो रहे हैं, जो हमारे दिल्ली रीजन से लाइव केसेस हो रहे हैं, वो गवर्नमेंट हॉस्पिटल से लाइव केसेस हो रहे हैं,
पहले
गवर्नमेंट
बार
सेटअप से।
पहले बार होता है।
पहली बार हो रहा है ये कि हमारे इंडिया में कि एक गवर्नमेंट हॉस्पिटल से लाइव केसेस टेलीकास्ट होंगे ऑल ओवर द वर्ल्ड, एक इतने महत्वपूर्ण प्रोग्राम के लिए। तो ये दो सेंटर्स हैं, एक है ये फरीदाबाद का सिविल हॉस्पिटल और दूसरा है गुरुग्राम का सिविल हॉस्पिटल। तकरीबन 7 केसेस जो प्लान्ड है लाइव टेलीकास्ट के लिए इन दो सेंटर्स में से
बाकी 7 इज कमिंग फ्रॉम आउटसाइड इंडिया।
सो ये एक अनोखी पहल है, अनोखी बात है पहली कि ये हम ऐसा हो रहा है पहली बार इंडिया में।
Actually, we want to just inform these things to you, to the media, as well as to tell this is possible for the people. Even with a 100% block, they can actually undergo angioplasty. Earlier, 100% block means even in one vessel there is a 100%, they will only go for a treatment called bypass surgery. Now, the technology is improved in such a level that most of the things can be tackled by simple intervention, that is angioplasty. So they can go home next day morning house.
तो जैसे बता रहे हैं कि पहले हार्ट सर्जरी के माध्यम से होता था इसका इलाज, अब तक कितने लोगों को आप इस जरिए ठीक कर सकते हैं?
मैं अकेला तो इंडिया में तो मैक्सिमम CTO एंजियोप्लास्टी करने वाला डॉक्टर हूँ। मेरा एक्सपीरियंस थे 1400 एंजियोप्लास्टी ऐसा 100% CTO का 100% किया था।
इसकी लगभग कौन जैसे हार्ट सर्जरी काफ़ी हाई लेवल की कॉस्टिंग जाती है, इसकी कॉस्टिंग लगभग कितनी जाती होगी?
लेकिन हार्ट सर्जरी तो कॉस्ट इज एक्चुअली डिपेंड्स ऑन द प्लेसेस वेयर यू आर, number 1. Number 2, where you are doing. Cost depends upon many things. Not only the technology is where you go and do the case, also the cost goes up. Which doctor doing, also the cost goes up. This also, I cannot just make a comment that what is the cost. Cost depends upon many factors.
लगभग डिफरेंट 50% का रेशियो है।
Actually, in BK hospital we do angioplasty at a cost of 55,000 to 1,20,000, depends upon the complexity of the case. And in the same thing, in some other private hospital, the same angioplasty cost nearly 2.5 to 3 lakhs. So this depends upon the lot of things, If you drive in a Maruti car, you drive in a Benz car, there is a difference. And note, even if you give the every facility in a Maruti car, from outside you will feel that Benz is better. So I can't tell that. So those comments actually I wanted to avoid,
सर इसमें आपको राज्य सरकार सपोर्ट कर रही है या कौन कर रहा है, और जो आप
No, it is actually it's a
जो प्राइवेट में ऑपरेशन होता है उसकी कॉस्ट कितनी है और सरकार में कितनी होती है, ये जरा बताइए।
No, it's a comment I don't want to make. Normally, there is a government scheme called Ayushman Bharat in one side, central government health scheme is another side, and the third actually the private party. So, what is my rate for doing a plumbing? A plumber can decide. That is actually the Supreme Court verdict. When you write an article in a paper, you can charge. Depends upon what you think you are, what is your capacity. So how can I tell that? Number 1. Number 2, I can write an article for 10 rupees. I can write an article for 10,000 rupees. I can make a film for 10 crore. I can make a film for 10 lakhs. So that is actually one side of the game. Second thing is actually what facility you provide. You come to a hospital where the room is fully air conditioned, your relative is getting a TV and a fridge separate, and your bathroom is separate, your care is separate. That is actually all depends upon what care you get. You only go for treatment, the cost can range from 70,000 rupees to 5 lakhs, depends upon the complexity of the case. In a 100% block case, naturally the complexity goes up. When you have a normal angioplasty requires one guide wire and one balloon and a stent. In a 100% block, you may require 10 wires, 9 wires, 5 wires. Then multiple balloons are required. If there is a calcium block is there, you have to take a rotablation to remove the calcium. When you have a block is actually so significant, you have to do imaging. Imaging means you have to go inside the blood vessel and see how the block is there. So those things are actually matters and the cost can go up. I think, can you explain these things?
सर कहना चाह रहे हैं कि बेसिकली कि कॉस्ट आपको कितनी फैसिलिटी आप कितनी चाहते हैं उसके मुताबिक कॉस्ट बढ़ जाता है। अगर आप एक प्राइवेट हॉस्पिटल में
No,
जाके
that is one side,
One-
and the complexity is also another side. If you have a simple block of 70% or 80%, there is no calcium there. Just put a wire and balloon. You can actually charge a little. At the same time, there is a 100% block which is blocked for the last 15 years. Then you require multiple wires to do that. Or if there is a right-sided block, I do in a right-sided block, the wire I take from the left side and go to the right side and do that. We call retrograde CTO, retrograde angioplasty, which actually again the maximum number is done in India by me. So those type of cases, when you do, your cost will naturally go up. Even if you are doing at the cheapest possible, the operator fees is very less also, material cost is very high. But it is possible. Actually, these type of things are possible. I just wanted to tell you that in a 100% block, angioplasty is possible. That we should not think that it is an impossible task. This is what is the message.
सर इसका कोई समय निर्धारित कैसे किया जाएगा, कोई डेट है ऐसा?
किस डेट्स को आप करते हैं प्लास्टिक? आप
सर,
ये पूछे जा रहे
ये
कि
जो
डेट्स
conference-
डेट को किया जाएगा जो आप लाइव कर रहे
नहीं,
हैं?
This is actually on Saturday and Sunday.
Saturday,
21st and
Saturday
22nd
and Sunday. Sunday we are doing actually out of the 14 cases, nearly 5 cases are happening on Sunday, 9 cases are happening on Saturday.
ये Saturday
And
Sunday.
Friday evening is only for a training for the young people who are just 1 year, 2 year, which we call fellows course. Post DM 2 years, 3 years, we will be giving the steps how to do, how to progress to the next level.
Doctor, you said you were going to telecast the whole process.
That will be only for the doctors,
Okay.
cardiologists.
How will you telecast it? And where is the source? Through which source audience will be able to see?
No, audience cannot see. This is basically for the training the cardiologist.
Cardiologist.
Only
This
cardiologist.
is not because it has been already in practice for
This is actually not the first
Eight-
time,
eight
but the 100% block live cases are first time happening in India, in Delhi.
Delhi region.
But usually we do live cases in many times, not only this time. I have done a national conference this time, just 2 months back, the National Interventional Conference in Ahmedabad, where it is not 100% block. It will be multiple type of things we have done there. This is only dedicated for only one, only for 100% block,
this is going to be medication only for the professionals.
only for the doctors,
Only for cardiologists.
only for the cardiologists.
Live सिर्फ एक
Cardiologist means
के
who are interested to learn these things, not for everybody.
हाँ.
There are cardiologists in the country, nearly 4,000 to 5,000 cardiologists are there. Many people are not keen on learning these things.
It is telecast at only some places. Not you cannot sit at home and see. That is not possible.
No. It will be live transmitted to the auditorium where 400 cardiologists are sitting there. It will be coming from Japan, it will be coming from Italy, it will come from France, it will come from BK Hospital, it will come from Civil Hospital Gurugram.
Around 550.
500, nearly 500, 350 to 500 is the registration. So we don't know what, how many they will come. They actually register this much.
Will this event be allowed for journalists to cover?
Journalists are actually not, usually will not come and see these things. If you come there, we have no problem.
It's highly technical also.
It's a highly technical, whether
So in journalists are also half-paid doctors.
journalists are actually not halfway doctors. Journalists are the real communicate.
I mean the health journalists.
No,
Health
basically communicators. Journalists are the real communicators to the crowd, and they definitely you people are the communicator.
डॉक्टर साहब मेन तो आपने सबके ऑपरेशन के लिए तैयारी कर ली, ये ब्लॉक ना हो, ब्लॉकेज ना हो, इसका क्या क्या मतलब होना चाहिए आदमी को, क्या क्या मतलब सावधानियां रखें?
Preventive
What they should
cardiology.
do so that they should
Basically,
not
who will get a heart attack? The people who smoke will get a heart attack. People who is actually a diabetic can get a heart attack. People will get a family history. That means their parents, their sisters, their brothers, uncles already having a heart attack. They have a high chance of getting. So people having a family history of heart attack, they should start prevention from the young age. I will tell from the age of 20. They should start controlling their diet. They should reduce their meat. They should reduce their oily food. They should do regular exercise. This is the way you can control this system. But even after controlling, People tell that I never smoke, I am doing exercise, I am a good athlete, even then how I got heart attack. Those things I have no answer. The only one person can give an answer is the best doctor in the world. So there are some questions we cannot answer.
So क्या is from genetic somewhere?
Eh?
Genetic.
Genetic definitely there. I'm just telling you, genetic is definitely there. I'm just telling anybody who is actually having a father, mother, or brother, or sister, or uncle having a heart attack, they should be very careful. Because how to become careful? Careful in controlling no smoke, regular exercise. If there is a high cholesterol, you should take medicine for cholesterol, and you should avoid unnecessary oily food and all. That will definitely prolong your life. In life, what we achieve in life is a person, everybody will die in one day. You may die at 80 years, you may die at 50 years, you may die at 90 years. You can select your death some more days more. Death can be prolonged, nothing else. That prolongation of death can be created by your own awareness and your own attitude to life.
So nowadays it has become a trend to have a sudden cardiac arrest. The comedian Raju Srivastava has got a sudden cardiac arrest, and many youngsters got sudden cardiac arrest. So what do you see the causes behind it?
Sudden cardiac death is produced by too many things. Today I am feeling that okay, I was not doing exercise for the last 5 years. Today I wanted to do exercise. I wanted to become like Hrithik Roshan. Then you will be in trouble. Your exercise should be gradually prolonged. Never do an exercise in one day and you don't do exercise for a long time. That is actually one cause of sudden death, plaque rupture created. Number one. Number two, there are a lot of young people are addicted to drugs.
On the contrary, you might have heard a news that a 9-year girl got a sudden cardiac arrest. So how is it possible?
It's possible actually.
And as young as 9 years.
9-year sudden cardiac death is not due to the heart attack. It is due to some other cause. Basically, there is some other disease called hypertrophic cardiomyopathy. There is a valvular heart disease. Heart is not alone only to deal with a block. There is arrhythmia, abnormal heartbeats. You have a mixing up of the blood. You have hole in the heart. Your muscles are thickened up. Your outside wall, pericardium is actually having disease. All these contribute. It is not, most of the sudden cardiac death in very young age, you should consider it is nothing to do with the blockage in the vessel. It is to consider other causes. No doubt about it. COVID actually created a lot of thrombotic events. So there are clots develops in the blood vessels. And not only in the heart vessels, it also in the lung vessels. So there is a breathlessness created. Many people are breathless after that. So the lung capacity comes down. So it is not only affecting heart, it is also affecting lungs. People may think that it is only a cardiac disease. It can be a lung disease. And most of the people get lung disease out of it. Regular exercise करना पड़ेगा, a pulmonologist का करना पड़ेगा, lung physiotherapy to be करना पड़ेगा.
There are a few questions. How much is the success rate?
Which one?
How much is the success rate of the operation?
Angioplasty.
CTO.
CTO angioplasty success rate ranges from 50 to 95%, depends upon the operator's skill. Whatever you do in any procedure, when you do anything, if I drive a car in the initial days of my life, I will look at down and look at the brake where the brake is. If I drive for 5 years, I will never look at the brake down because I know the brake where it is sitting. So these are all the technical things are experience. Once you do regularly, you will get more experience. So experienced cardiologists get a success rate of nearly 85% to 90% in 100% block. In a normal angioplasty, success rate is ranging up to 99 to 99.5%.
What is CTO stands for?
Chronic total occlusion. Chronic total occlusion. What is chronic? Anything more than 3 months is called chronic. Total occlusion means 100% blockage, which is present for more than 3 months. That is called chronic total occlusion. No, it is every year it is happening. Last 2 years it is not happened. It is first time happening in Delhi. It happens in various places in the country.
Delhi NCR is the problem.
I have done. I do CTOs many places out of India also. I go and train Philippines, Indonesia, all those countries. This conference happens every year in US, every year in Europe. Next, actually, in the September second week is in actually Europe. Last in the month of June, it was in Paris.
He's talking about IJCTO.
IJCTO happens only in India because it is an Indian conference. We actually collaborate with the other people from out of India. That happens every year. It never happened in Delhi so far. It happened in Mumbai, Hyderabad, Cochin. Regularly, this time it is happening in Delhi.
And now that you said that journalists have nothing to do with that operation system and all.
I never told.
Now it told only cardiologists, they will attend this conference.
No, only cardiologists mean this conference is for the cardiologist. I never told journalists is nothing to do with that. Journalists actually, I told that journalists are the communicator between the technologist and the normal common man. That is what I told. And usually this is only for the cardiologist, not even for the basic medical MBBS doctors. That is what I told. I never told journalists are not good.
So if you come there, you can attend the session.
You can attend the session. How much you will get out of it, I don't know. That is what I told. I never told you don't come. You please come.
Government collaboration we are doing in Haryana.
Actually, I am. Sir, actually.
जो जिले का डॉक्टर है वो अभी 1980 की उस पे चल रहा है पीएड पे आप तो आगे निकल आए अपने बीएमडब्ल्यू पर बैठे तो उसको लिए कुछ कर रहे हैं ये बातचीत या नहीं
I just compared it.
सीएमओ जो रहता है वो ये हेड होता है हार्ट का वगैरह का तो उसको बनाते हैं उसकी भी जो टेक्नोलॉजी है बहुत पीछे है तो उसके लिए कुछ कर रहे हैं सरकार से बातचीत ये मेरा कहने का
अभी केस होता है सीधे गया डॉक्टर के पास सीधे बैठकर सर्जरी करो
दूसरी टेक्नोलॉजी बहुत पीछे है मैं ये कहना चाहता हूँ आम आदमी को भी इस टेक्नोलॉजी का फायदा उठे ये मैं कह रहा हूँ
Correct. आप सच्ची बात बोल रहे हैं. I wanted to tell you that I am IJCTO conference I am doing, but I should tell you one more point. I am actually running 4 cardiac centers in Haryana, Ambala, Panchkula, Faridabad, Gurugram. These places are done by public-private partnership, a PPP model. And we are doing angioplasty at a cost of less than 60,000 rupees in these places, and which is less than Ayushman Bharat rate in India. So that means we are approachable to the common man. At the same time, normal person, normal cardiologist, if you tell them to go and take an ECG and train the ECGs, people will not be willing. Actually, this will be a mega project as you told. You should reach out to the common man to understand basic ECG program, reaching up to the primary health center so they can identify a heart attack as the earliest point and then reach out to that. I was thinking that even all these Janaushadhi medicine shops, we should have an ECG machine and somebody should take an ECG and that ECG should reach to the one cardiologist to identify if there is a heart attack, they should go to the nearby hospital and get treated. And that type of things will come in the near future. My communication is actually, I am actually not good in Hindi. I am actually from Kerala, that is why the...
उसमें भी बोलेंगे कुछ जानने वाले हैं
मैं तो हिंदी में
मलयालम में भी जानते हैं मम्मूटी के बाद तो आपको दिखाना
मैं तो हिंदी में बात करने के लिए कोशिश करता हूँ. मेरा हिंदी को एकदम अच्छा मार्क मिल गया था 12th स्टैंडर्ड में. उधर हिंदी में मार्क करने के लिए इजी है. अब हम लिखता तो 100 मार्क में 95 मिलता है. कितना दिल्ली में आता है मुझे मालूम नहीं, लेकिन the people are yeah definitely all cardiologists from all over the world, all over India. We really don't know how many people are coming, but nearly 350 to 500 people are registered. So this program is basically for training people, but nothing to do with the CGHS programs.
ये एक ट्रेनिंग प्रोग्राम है, इसका मतलब पैनल से कोई लेना देना नहीं है, एक ये ट्रेनिंग प्रोग्राम है कार्डियोलॉजिस्ट के लिए, ये एक इंडिपेंडेंट प्रोग्राम है गवर्नमेंट प्रोग्राम्स के लिए।
पेशेंट जो है आप कह रहे हैं कि ड्यूटी करेंगे,
हाँ
इसमें
जी।
दिल्ली एनसीआर का पेशेंट है क्या?
फरीदाबाद का पेशेंट है, गुड़गांव का पेशेंट है, दोनों लाइव सेंटर्स है, यहाँ से लाइव टेलीकास्ट होगा। टोटल 7 केसेस है जो टेलीकास्ट होने हैं यहाँ से।